Good morning everyone. This is Dr.M.Shapna Yasmin, Head Department of Psychology. So today I am going to talk about the topic schizophrenia. What is schizophrenia? So if you talk about schizophrenia, it literally means fragmented mind. Schizo is one of the most complex, chronic and challenging of psychiatric disorders that affect how a person thinks, feels and behaves. It represents a heterogeneous syndrome of disorganized thought, delusions, hallucinations and impaired psychosocial functioning. So if I talk about the thinking part, okay, it's a psychiatric disorder. It is not a neurological disorder, it's a psychiatric disorder. Automatically it affects the person, how they think, how they feel and how they behave. And it is a heterogeneous syndrome of disorganized thoughts, delusions. Delusions means that you may have stimulus will be there, but you felt perception with stimulus, that is you perceive some other thing and with stimulus. For example, if you see the rope, you might think of like a snake. And hallucination means perception without stimulus. That means you're just hearing the voices, like someone is going to kill me, that they said keep on telling me like this. That's what they used to say that. And impaired psychosocial functioning, so they keep on talking different things like this. Next one is etiology, that means causes. While many factors have been associated with developing schizophrenia, it including genetics, that is it comes from the gene also, and early environment, neurobiology and psychological and social processes, that is the exact cause of this disease is unknown. So even though you may have find out the lot of causes will be there, but even we couldn't be able to predict the exact cause of this schizophrenia. If we talk about the first cause, that is viral infections and immune disorders, that is schizophrenia may be triggered by environmental events such as viral infections or immune disorders. For example, babies whose mothers get the flu while they were pregnant at higher risk of developing schizophrenia later in life. People who are hospitalized for severe infections are also at higher risk. So according to environment also plays a major role. It may happen to the children in the adult stage or adolescent stage. And if you talk about the genetics, that is hereditary, scientists recognize that the disorder tends to run in families and a person inherits a tendency to develop the disease. So those who have same problems in their families, it might happen to the children also, grandchildren also. So similar to some other genetically related illnesses, schizophrenia may appear when their body undergoes hormonal and physical changes. So if we talk about genetic, even though in their family that they may have the same, undergone the same problem, even the grandchildren or great grandchildren have also the, might also be the reason to have the same schizophrenic problem will be there. The risk of developing schizophrenia is also increases to approximately 10% if a first degree relative has a illness and to 3% if a second degree relative has a illness. So if we talk about the relatives, if it is a first degree relative means then 10% of the children may have the chances to have schizophrenia. And if you talk about the second degree relatives will be there regarding the hereditary, it have a chances to be at least 3% may happen to have the children as schizo. So if both parents have schizophrenia, the risk of producing a schizophrenic offspring increases to approximately 40%. So if you talk about both male and female, that is parent, both husband and wife having the schizophrenia problem, so if it may happens to the child and it complete and they have talking and they are telling that 40% approximately is a chance to get the baby to have the schizo in their adult stage or in the adolescent stage also. And if you talk about the epidemiology, that is the prevalences of schizophrenia ranges from 0.6% to 1.9% with an average of approximately 1%. So if we see it exists around in the world, it happened 0.6 to 1.9% of the persons are having the schizophrenia and approximately 1% average that they are getting. And schizophrenia is the most commonly has its onset in late adolescence or early adulthood and rarely occurs before adolescence or after the age of 40 years. So maximum we see that schizo comes under the adolescence, late adolescence and adulthood age, and after the age of 40 years. The peak age of onset are 20 to 38 years for males and 26 to 32 years for females. Slightly more men are diagnosed with schizophrenia than women, and women tend to be diagnosed later in the life than men. So we can see through this statistics that we can able to find out that men have diagnosed earlier than women. And next we see the types of schizophrenia. That's the first one is paranoid schizophrenia. Paranoid means normally that they have the suspicious nature. So it's a common form of schizophrenia, that prominent hallucinations or delusions, that someone is keep on telling me, or someone is seeing me, or someone is trying to harm me, that they are used to keep on telling like this, may develop a later age other than the types of schizophrenia. Speech and emotions may be unaffected, so they keep on have mood swings will be there and keep on saying some other talk while they communicating some other thing, at risk for suicidal or violent behavior under influence of delusion. So in that if we talk about the delusions, that someone is want to kill me, someone is try to kill me, someone is force me to try to undergo suicide. So this may happens, the risk of suicidal behavior. And hebephrenic disorganized schizophrenia. So that is if one try to talk some other thing and automatically they will switch on to the some other topic. This is what disorganized schizophrenia. And next, behavior is disorganized without purpose. So they couldn't even though sometimes if you talk about the speech may have disorganized, sometimes the behavior also get disorganized, and that we couldn't be able to find out, they don't have any purposes will be there, and their thoughts are disorganized, so that they keep on talking different things, they couldn't be able to have no connections will be within their talk, difficult to understand by others, like pranks, giggling, health complaints, grimacing and mannerisms are common. If you talk about grimacing, means that they are showing some types of mannerisms on their faces, like a frowning on the face, it's something like that. And next, delusions and hallucinations are fleeting, so keep on having the same type of delusions and hallucinations will be there. And next type is catatonic schizophrenia. Rather than other types, it has risk for malnutrition, exhaustions or self-injury. They try to injure themselves and they couldn't be able to eat because of they couldn't be able to eat because of cleanliness. They keep on they trying to clean everything, all those things. Unusual movements, often switching between extremes of overactivity and stillness. Okay, they keep on changing their behaviors, like movements, that is if they work and suddenly, otherwise they still numbness without doing anything. Unable to talk, that is catatonia behaviors, they couldn't able to talk, they can just they used to tell that something happened to my throat or something like that. Undifferentiated schizophrenia, even we couldn't be able to find out what type of category this person is having. Some characteristics of paranoid, hebephrenic or catatonic schizophrenia, but does not obviously fit one of these types. And next is residual schizophrenia. This is normal one, and it keep on happening to all the persons who are having schizo. Past history of psychosis, but only having negative symptoms. Okay, so normally those who are having schizophrenia have some past history of psychosis. They may have undergone some psychiatric disorder problem will be there, and also have some negative symptoms will be there. Because of that, they may have reached the stage of schizophrenia. Next, if you see the signs and symptoms, if you talk about the positive symptoms, means the delusion, that is false belief that they are not based in reality. So they keep on having some false belief that already I have told that if you see the rope on the ground, they used to say it's like a snake. This is what a false belief that they are having. And if you talk about hallucinations, they're just involving seeing or hearing things that doesn't exist. Someone is calling, someone is telling me something like that. And for a good example for hallucination is the movie 3 is Dhanush have played a movie that we can have a good example for hallucinations and delusions. Disorganized speech and thinking, effective communication can be impaired, and answers to questions may be partially or completely unrelated. So if we ask some question, they will answer some other answers for that questions, and keep on switching their answers to some other questions will be there. And catatonia, purposelessness, abnormal motor activity or aggressive behaviors. Suddenly they started doing aggressively, like biting or throwing something in their hands. That type of behavior may have some type of positive symptoms in the schizo. And if we talk about the negative symptoms, that is flat effect, that is reduced expression of emotions via facial expressions or voice tone. They don't show anything on their expressions, that is just reduce their emotions. Then we couldn't be able to predict at what stage they are, the patient will be there. Allogia, that is reduced speech, they won't speech much. Avolition, inability to begin and sustain activities. So whatever the activities that they are doing, they couldn't be able to begin and stop or continue that activities. And hedonia, inability to experience pleasure, they can't experience any kind of pleasures. As asociality, that is withdrawal from social contract. Reluctance to perform everyday tasks, they can't interact with people, they keep on withdrawing the interactive with other persons, that is socially they couldn't be able to move with socially. And next symptom is cognitive symptoms, that is poor executive functioning, inability to understand information to make decisions. So they couldn't be able to understand the information properly, and it also affect their decision making process. And next one is poor working memory, inability to use information immediately after learning. So they can't able to use their informations after whatever that they learn, and that learning informations can't help them to use many information, so that also affect a lot. So these are the symptoms of signs and symptoms of schizophrenia. And next we talk about the diagnosis. Diagnosis means how we can predict through it can be predicted through the Diagnostic and Statistical Manual of Mental Disorder, that is DSM-4, published by the American Psychiatric Association. So based on their criteria, that we can able to find out according to which problem that they may have, we can see in that this type of category problems. And next one is medical history. We need to know about the past medical history, whether they may have undergone any psychiatric problems or any type of illnesses or something like that. And next we used to take blood test or imaging, like scan, all those things, blood test. So after that psychiatric evaluation. So based on the three, we couldn't able to find out, then automatically the fourth one, psychiatric evaluation. So we used to refer the patient to the psychiatric doctor to have further references. So normally we used to go to the psychiatric evaluations only. And this is a prognosis, that is there is no prognosis means a final stage 1. There is no known cure for schizophrenia. So we know that we can able to treat the schizo patients, but there is no known cure. We couldn't able to completely cure the schizo patients. Fortunately, there are effective treatments that can reduce symptoms, decreases the likelihood that new episodes of psychosis will occur, shorten the duration of psychotic episodes, and in general offer the majority of people the possibility of living more productive and satisfying lives. So based on that, we can't able to cure completely, but we can give some effective treatments to reduce their symptoms and increase their livelihood. That alone we can do it. And with proper medications and supportive counseling, the ability to schizophrenic patients to live and function relatively well in society is excellent one. So if the patient is keep on taking medications and getting a proper counseling, then it helps them to move in a society in a proper way, and they can able to interact well in the society. That is about that we can see in the prognosis. And the last one is conclusion. So what is that? If you talk to God, you are praying. So if you are praying means you normally talk to God. If God talks to you means automatically you have the problem of schizophrenia. So the persons who are having schizo, they used to say that God is talking to me, God is telling me, God is guiding me, God is telling me, something like that. So this is what happened. This is the conclusions. Thank you.